Hello friends, this is Dr. Vidyasagar Chandankere from Hyderabad. So we will be seeing about spica care in children, and most common indication for hip spica is either a fracture of the femur or hip dislocation. This is a child where the left hip is dislocated. We did surgery and reduced the hip, put the child on 1.5 hip spica, and please see the diapers. They are to be aligned not like this outside where the inner wet part touches the spica. It has to be pushed like a shirt inside a pant. So it has to be done front, back and sides both in the same manner. And now we will see how to lift the child. We should never lift with just the abduction bar or the spica. Neither you should just lift the child alone without the bar. So ideally both should be lifted simultaneously. Hold the baby as well as the spica. This is possible in younger children who are small. This cannot be possible in older heavy children. And that's how you hold the child. And the feeding should be done in this erect position only. Look at the diaper again. We have to push the inner margin towards the skin like a shirt in a pant and not on the plasters, because the plaster has soft cotton and padding which may get wet and create rashes. Check the edges for any sharp points again. And when the child is sleeping, because there is slight angulation in the hip spica, a pillow needs to be kept below the legs. Now once we raise the head up, we can see the spica actually becomes tight near the chest. So that should not be there. And other thing, once we remove the pillow, the spica may press behind the back there. So even that should not be there. That's why we need the pillow. And the baby and the spica should move simultaneously. It's easier to handle the babies in bean bag rather than these things. This is how the feeding should be done. And after feeding, make sure the child burps before making the child sleep on the bed. And this is example of a child on bean bag and a child doing this activities in spica. This is what, if you don't take care, that's the rash which is there in the bag. So be careful. All the best and thank you so much for watching the video.